Hello, I'm starting the recording now for Module 1, PB105. Give me just a quick while we move into the first PowerPoint which you have embedded. Keep in mind the PowerPoint use most every week that are embedded. Pictures are added and some words. It's not. I'm going to be starting today with phlebotomy practice. Excuse me. Phlebotomy is the field in which you are about to enter. You have a wonderful text in which you can use for great referrals. I encourage you to read the text as well as participate in all recorded lectures and take a look at those embedded PowerPoints as well. For the first, you as the phlebotomist also describe different hospital departments in which they participate in a patient's health care, what the department does, and what your role as a phlebotomist is in that department. The organization there, what clinical lab, and what your briefly in this PowerPoint we're going to tell 88, the clinical lab improvement amendment that was passed through Congress in 1988, basically laying the groundwork to human testing are providing the best quality standard tests that they some legalities there. And so let's start out with the word. The definition of phlebotomy started with the Greek word broken apart, the first part being phlebo, and tomi is the second part of it. This relates to being of. There's several terms that in your book you'll see the words venesection, or as you can see it's spelled differently, venesection, venipuncture. You will see the term phlebotomy and blood collector used interchangeably within this text. About a phlebotomy as procedure of collection. They did phlebotomies. They refer took place where they basically just cut the arm, cut a portion of the body, and allow, so to speak, or the drained. We're going to cure people. Obviously, we've come. That is basically your history lesson for phlebotomy. Phlebotomy, honestly, it was just kind of phlebotomy was just the process of removing earlier. Nowadays, team or the phlebotomist collects specimens which can be used in several different ways. Testing can be used abnormalities in the results indicating a medical condition. It can be used as a therapeutic that would be done. When I'm talking therapeutic, it's making sure that we are patient with the right level of medication maybe in therapeutic drug monitoring. This would be a case that also I have listed here monos would be like, if you may know someone who has had celiac issue and they have to we're just monitoring, make sure that their IN is at a good therapeutic level. So these are the three important clinical in which phlebotomists play a very vital role. Now, as we move into talking about phlebotomy, the ranges of which the testing they do or the role in which they play is so tremendously different where you work. They have very large range of detail that some of them are cross-trained to do clerical, just drawing blood all day. They vary tremendously, and that's why I love this class, because people need to really embrace the fact that phlebotomy can mean so many different things to people if you're a certified phlebotomist. It can have positions inside a clinical lab, inside a clinical lab of a hospital. It can also be in a outpatient lab that you may be useful. Also, home health care uses phlebotomists in instrumentation that they take out to the site, and the phlebotomist can utilize that. Talking a little bit more about the clinical lab person. In this particular, I have listed lab person here and a brief description of positions that are in the clinical lab. Typically, we see medical technicians. That's either a 2-year or a 4-year distance that you will see there. See working in the clinical laboratory. Also, the other individuals who work in there would be the IT people or the clinical lab information operator and programmer. There's clerical staff. There's individuals who work closely with the lab on quality management, safety, depending on a department in of itself, action control, separate department. Just know many pieces together in clinical working with lab personnel. Okay, we're going to be a tiny bit educated. I like to everybody's that the requirements vary depending on the region of the country in which you're in. A high school or equivalent is usually the most often required to enter the phlebotomy program, but what they can do varies depending on what part of the country you live in. They examination and attend continuing education program. If you have any of you took ML 100, we talked about about continuing with and aware of all these different ones. Clinical immunology, blood bank, which is called immunohematology, microbiology. Support services would be that say for you. They might be the individuals who refuges. They're like biotech people. There's also the lab information systems people. Those are the IT. And there's also point of care testing. This has grown greatly in the last 5 years, and now in most facilities of any size, they do have an that's monitored and for it, so they have their own CLIA number for point of care. And there is usually somebody that in the hospital. Now, as stated quite early on in this, it's important that you go back to recognize the hospital is, the setting for what it is, and also recognize types of healthcare departments that we see in health. The reason I have this in here is because it's important that you know your role in having to work with people in these departments. So here's a number of different departments. Table 1-1 in your text basically covers all kinds of different healthcare departments, and it actually has a little explanation of the function of that department and the personnel that work there. So that would give you some idea as to what your job would be. If I were to ask you what pediatrics was, that would be more, I want to know that you understand pediatrics differs greatly from podiatrists, feet type doctor, whereas pediatrics is for children. You need to understand basically the different within a healthcare facility and what your role would be in dealing with them. Here are some more, knowing pulmonary, radiology, surgery, and urology. Have different roles in healthcare and different things for the. That's the last slide. In this one, I move on to the next, which is on PowerPoint, which is basically about equipment. So I need to be able to find a historical. Give me one moment, please. It takes me where I stick all these things. Okay. Equipment presentation, very short PowerPoint. Basically, I give you a view of the kind of equipment that you should be familiar with by the end of the first couple weeks. Just recognizing what you're going to be using. Also understanding that phlebotomists do both capillary and venipuncture procedures, and the equipment in which you use would be completely different. First, we're going to talk about ETS, which is called the Evacuated Tube System. Your book will frequently talk about ETS. This is a vacuum tube system. It requires tubes that are going to the blood, negative air pressure. I'm over here. These holders, which are light blue, them clear. Where this is a type of an adapter that you actually screw a needle onto. The needle is double pointed. There's a needle that goes in the arm. Obviously, this one goes into the arm to go into the vein, and the opposite end. This needle, the arm, this part part is the holder and pushed into the test tube to collect the blood. Pierces the tube, fills with the exact amount that it needs to have in based on manufacturer recommendations. So this is a ETS system. You have a plastic holder, and that holder is where your test tubes will go. We're going to talk briefly about needles. Probably one of the biggest things that you want to learn right away is when we talk about gauge of needle, we talk about the diameter of the needle. Smaller gauge needing 22 and 24. As I go up, the diameter of that needle is the bigger the number. So a gauge needle is going to have a very large diameter opening. So you're going to use a much larger needle bore opening when you're donating blood for the American Red Cross, or if you're drawing a blood sample. So it's a very small, but there's different types of needles. All safety needles. Whenever you cap a needle, it's very important that you look and see that there's no needle, because obviously they're all manufactured, and I have run across needles in my life that had a little burr, and you definitely want to catch that before you use it and dispose of it immediately. The needles that are used in the ETS system, obviously I told you they had the two, it has a needle on both ends, and the inside the holder you can push tubes on. This gives us the ability to collect multiple tubes with one needle. This is a really nice benefit. This needle is called the butterfly needle, and it's gotten its name most probably because of this little butterfly appearance wings that's on it that you hold. This is also called an infusion set, but it's actually used to draw blood out of small veins. Most of the time, needles are in the size of 21 or 3 gauge needles. They're small, and they have a little bit of thing that you'll see connected to that needle, because let's see if I can, this is actually the needle, and then this is the tubing that goes right through to this little gray part, which is nothing more than another needle that is screwed into that adapter. This is empty. So anytime that you're using a butterfly needle, you need to be certain that that's going to be empty, but it's full of air. So if you're collecting a sample with a butterfly needle, you need to recognize that if you have a critical fill tube, like a tube for coagulation studies, you would need to have it drawn first, because in that tube, some of them are up as long the tubing is, take the place of some of that negative air pressure